Hi, everybody. My name is Linda Goode, and I'm a social work case manager. I'm happy to be here. I'm going to be contributing part-time, depending on what kinds of things you all are interested in. And I thought I would start with an introduction to social work, the field of social work, especially since many people don't really know how broad the field is, and sometimes people have touched parts of it, but they don't really know that there's more to it. It's helpful sometimes to have an overview so that you kind of know what's available and what types of things people can do and to help in the field of social work. So because there's multiple Lindas here, you might have to say my name more than once, because I know that Linda is like the main person who runs the program, and you can also just say Linda G, and I'm happy to answer what other questions you might have. The field of social work is as large as the society itself, because it is about society. And so it's a huge field with lots of different aspects of it. Do any of you have any ideas of what social work is, or have you ever had any experience with any parts of it? Or
I'm an MFT, so I did.
okay, yeah,
Training in social work.
yeah, and then you would know what the field is about, yeah, because it's parallel to your field, yeah. So lots of interactions and knowledge about the counseling part of it, and that social workers help. Yep. Department of Health and Human Services. Yep. That is a big part of social work as well, which many people don't know. Anyone else think of anything? Okay. So social workers serve in a variety of different areas, just like some of you talked about, from child welfare programs to veteran services to schools. There's more and more social workers now in the schools. Since COVID, they've increased that. There's social workers in hospitals and social workers in behavioral health. The roles may be different in each of those areas. People have specialties and focuses that are very specialized in some of those areas, but the fundamental overall values and the ethics that guide our practices are all in unison. And so according to the National Association of Social Workers, which is our governing, our body that oversees our code of ethics, in the preamble, a historic and defining feature of social work is the profession's dual focus on individual well-being in a social context and the well-being of society. So it's both things. So while it can encompass counseling, very frequently it encompasses counseling to also consider the person's situation and their environment. That piece of it, that's one thing that's a little bit unique to the way that social workers are trained and think. So the following are ethical principles that should be the same no matter where and what specialty a social worker might work in. And there's service, social justice, dignity and worth of a person, the importance of human relationships, which we all can see that even just the relationships here can make a difference, because we're all social beings as well as, psychological and physical. There's all those things are important parts of healing, health, well-being, also the integrity and the competence. So part of competence is like, say, for example, if it's not something that I'm competent in the field about, even though it's part of social work, that it's important for me to know where my limitations are to refer to another service or person that might be their specialty. So sometimes social workers will say, I can help with you find the right person for that. And sometimes people will feel like, well, can't you help me with that? And yes, we can, but sometimes there's somebody who can help even better. And so part of our role is also to help you not only get assistance that you might need, but connect with the person who can give you the best assistance. So there are some real pioneers that started out with social work and helped create the field. One of the most notable is Jane Addams. She established settlement houses in Chicago. One of them is called Whole House, and there is still a little bit of Whole House left in the University of Chicago's university campus. she did it with some of her friends, and her goal was to help people who were living in poverty and had some limited skills to help gain skills, education, language, to access resources and improve the quality of their life. And she was able to make progress with those types of things, along with some other friends that helped her as well. She is really an example of the beginning of social work in the United States. There was also some things happening in Europe, so I don't want to say she's the first ever, but she's the one that's most written about and recognized as one of the pioneers. And she also was one of the first women to receive the Nobel Peace Prize for her work. Frances Perkins was a volunteer who worked with Jane Addams in Chicago in the settlement houses. She became interested in social work and public policy. She ended up earning her master's degree in political science through Columbia University. And throughout her career, she worked to advocate for workers' rights, including the hours and the types of working conditions. She helped with labor laws on a larger scale, and she ended up serving with Franklin Roosevelt's Secretary of Labor, and then she drafted much of the New Deal that includes Social Security and fair labor practices. So that can kind of give you an idea that social work touches a lot of different aspects in a large field. Obviously, somebody who's working in public policy can really make a difference for people, but they may not know the ins and outs of some psychotherapy or some counseling as well. That might be something that they would refer people to someone else who that might be their specialty. But at the beginning, these people were doing a little bit of everything. So then the one that really brought a lot of social work to the healthcare setting was a nurse and a pioneer, Ida Cannon. She began to see the need for social work in healthcare when she was working with Dr. Cabot. And so at her experience was that there was more to health than just health itself and the physical aspect, that the emotional aspect contributed to a lot of the healthcare treatment, and addressing those things she felt was necessity to be able to help people with their health. It was vital to the treatment. So she ended up enrolling in a social work program. She got additional education through the Boston School of Social Work. And then she ended up working with Dr. Cabot, and then eventually working at Mass General and creating a larger services. She ended up with like a very large amount of people working with her, including volunteers, very quickly. And she ended up writing social work books. She organized American Association of Hospital Social Work. Very quickly, they ended up taking some of the people that were working with her and giving them specialized services in places like cardiology and nephrology and some of the different aspects, because they recognized that each thing had its own unique complexities that could help serve patients in a better way if people specialized in it. So now, more recently, social work is commonly divided into 3 areas of focus or practice, which many times they overlap. So the counseling and therapy is oftentimes considered under a micro focus of micro practice, meaning micro is smaller, so more on an individual and customized basis. And there are people that that's really their main focus, and that's really what they do. And they do that best. And then meso, which is the middle ground, where it's a little bit larger group of people that social workers are working with. They work in neighborhoods, community centers, hospitals, health systems, and then also group treatment programs. Those are people that are good with groups and individuals both, and can kind of help with families and in neighborhoods, things like that. That's their main focus. While they'll know a lot of the other things that overlap, that usually is like their specialty. And then there's macro, which be working for like the Department of Health. Those are people that work on a large scale. They do research, they collect data, they do community organizing and public policy. So many times somebody who might work down at the Capitol, they may not know exactly where the most resources are for an individual, but they can usually help you know who to ask. They can help you get to that place. And sometimes it does take things that happen at the Capitol to help people on an individual level. And so that's why our field is so broad. Social workers in healthcare may serve in a lot of different areas within the healthcare system. Many people don't know this, so I thought it'd be good to go over this just so that people know what's available out there in case you or somebody in your family or your friend ever needs it. So at the individual level, the micro level, social workers may assist with psychiatric crisis, behavioral health support during a healthcare crisis, and they can provide individual one-on-one therapy and counseling. So Medicare actually does cover therapy with social workers, and they just recently added marriage family therapists. It's just more recently been added that as long as a therapist goes through the credentialing process with Medicare and agrees to be a provider for them, it is something that's reimbursable for people to have individual therapy by a social worker and now also a marriage family therapist. At the individual and family level, inpatient hospital care social workers and patients get help with them through a variety of different things like accessing barriers to the care, addressing any kind of financial things that they might need, addressing discharge needs to be able to set up supportive care afterwards, and also notifying next of kin. Frequently when people come to the emergency room, it's the social workers that help contact the next of kin and let them know and try to help them with a plan to connect with the patient at the hospital while the healthcare providers are providing the care and stabilizing the situation. Outpatient primary care, social workers work in some of the different clinics in primary care and also telephonically in a lot of different systems to different address needs that patients might have and help them connect with resources. They sometimes work in places like hospice and home health. Frequently, they also can be found in dialysis centers. It's a requirement for a lot of different types of services to have a social worker. So dialysis is one of the ones that's required. They help people with filling out paperwork for additional coverage and benefits to be able to cover the dialysis treatment and then also coordinating transportation. The cancer center is another area where they're actually required. A comprehensive cancer center is required to have social workers that can address things that people might go through that help improve their being able to access treatment and tolerate some of the things that they need to go through to get the additional emotional support. So those are some different places. And then at the community level, social workers work in the public health. They work in the county systems and also in the state Department of Public Health and social services with public policies, with creating different funding and supporting different programs and the growth of programs and advocating for things that individuals might need within the community. So those are some of the different things, and that kind of shows you from an example of going from the micro to the macro level. It's a big, huge field, and there's no way for anyone to know everything. So, but most of us can get you to somebody who might, because we usually know if we may not know all the information for all the field, but we know who to ask and we usually know how to kind of get there. So a little bit about myself. I first started in healthcare as a certified nursing assistant and a radiologic technologist in the early 1980s. Goes by fast. I didn't know anything about social work, and so that wasn't really on my radar of things to do. But then I started, I appreciated all aspects of radiology. I really loved working with the patients. I loved their stories and how their stories intertwined with things they were going through. And then I also found that listening to them while I was also taking x-rays and doing procedures helped them feel better, put them at ease, because it's treating the whole person and it's supporting the whole person. And when someone shares their story, then you know what's important to them. And sometimes you can make a difference. And I really loved that. Then we did more programs to help people who didn't have insurance get access to different procedures or different x-rays. And I loved that coordination and community outreach. And so somebody said that is social work to me. And I was like, really? And so the more that I looked into it, the more I realized a lot of the things that I loved were both part of radiology, but then also I could do more of it if I went into social work. So I ended up serving, well, getting my master's degree here at Sac State, and then serving as the first social work case manager at UC Davis Health on the inpatient side. I worked in cardiology and then also in the internal medicine. And I helped with all different types of things, including coordination of resources, connecting with community resources, discharge plans, things like that to support people in getting some of their choices and their needs met. And then more recently, I worked with the outpatient case management side and helping people connect with resources, helping people with finding therapists, identifying some of coping skills for things like anxiety, depression, and grief. And so now I'm here because I retired a few weeks ago and I wanted to contribute here. And I also wanted to open it up thinking about how broad the field is and how many things there are out there. And then a little bit about myself, what things you all think I might be able to contribute here that you think would be helpful. So I'm happy to help with different types of things. It can be anywhere from like grief, coping with grief. And by grief, I don't mean just big losses, but even like little losses of when you can't do things you used to be able to do anymore. That actually is a type of grief. And it can be a real loss. And there's not always a place to talk about that, but sometimes we all need it. So I could help with different things like that. I can help teach people about depression, anxiety, different ways to cope with those types of things when they come up and kind of what they are and how to recognize them. I can help people with resources and talking about different resources in the community, depending on what you all think might be helpful to know more about. Even if you're just curious about it, I'm happy to try to find ways to add those into the program. And so I encourage you to kind of think about it. Doesn't have to be today, but just in general, what kind of things you'd like to learn more about. I'm happy to share. Sometimes just having the information knowledge can be power too, because then you can know a little bit more about what to ask for and what to look for. And then also I'm working on getting certification in mindfulness facilitation. So I'd be willing to contribute some of that and happy to contribute some of that here if you'd like little additional exercises in mindfulness in addition to what you already have. That is like a really great program too. So kind of to wrap things up, social work is a century-old profession. It offers services in many aspects of healthcare, the community. The hallmark is that we believe in individuals' right to self-determination. And that includes all of your right to decide what it is I do here and what kind of things you think might be helpful is a really important part of it. And so that's my goal, is to kind of help with that type of stuff. I can also facilitate creativity and artwork type things too. And that's something that I like to do. And I'm happy to add that if any of you would like that as well. Does anyone have any ideas now that they could think of off the top of their head? Not to put people on the spot, but just if you had something you thought of.
You said you were at the UCB in 2 departments.
I worked at UC Davis at the main hospital, and I worked in internal medicine and cardiology on those floors. And then I also worked in, then the second half of my social work career, I worked in the outpatient side.
So like, how did you get to, I mean, did doctors were, say, hey, we have this patient, or did you go not canvassing, but
So I did both things. So yeah, so doctors would refer patients and say that people needed help. And then also if like I was on the floors, the nurses would come up to me and say, this patient is asking for this type of resource or help, or they're experiencing anxiety or depression or things like that. They need some help. Then I would go in, or if they'd say, sometimes even say the patient's crying, we don't know why, they don't want to share that. Can you go talk to them? And so then those are different ways that I ended up helping. On the outpatient side, the doctors would oftentimes, if patients shared in their primary care appointments that they had needs, then they would frequently make referrals to us. So sometimes what happens is people don't really know it's hard to separate out what might be something mental health or behavioral health. and versus something that might be physical. And so they'll just go to their doctor sometimes and say, I don't feel good. And the doctors will do screenings, and then they can make referrals to us, so that we can do further assessments and say, hey, have you thought about counseling? Have you thought about these different things? And then we help them with ways to find counselors in the community that are covered under their insurance plans. So that's another way so that's the other thing I can also even do, is like how to find a therapist. Like how would you look if you ever needed one, is another thing I could help with. But it's a good question because it's different. And I can say that if you go to your doctor, 80% of mental research has shown that 80% of plus or minus mental health first shows in the primary care doctor setting. Because like I said, many people don't know what they have. And if they do know that they have a problem, they don't really know where to go to get help with it. So more and more primary care are like assessing for those kinds of things. And so you might have seen that they ask you more about depression. They do screeners now more often because they know also it affects like how you heal. So for example, if you're feeling depressed and you're lethargic and you don't feel motivated, then you're not going to probably exercise or do any of the things that you need to do to get better quicker. And if you feel anxious, you might feel so anxious that you have difficulty following through with certain things because it's overwhelming. And so those are things that, are definitely things that can be improved with a variety of different interventions, depending on what the patient or client or individual is interested in. And then sometimes when you just bring the symptoms down even a little bit, it helps the physical part too, because then find yourself more motivated and more able to participate in things that are helpful to you. That's just really common. A little bit of anxiety can be motivating, right? It can get us out to do some things. And so anxiety does have a useful tool, even with studying and getting things done. But when it gets too intense, then it can be a barrier where people feel like they're afraid to do anything. So there's kind of like, it's important to balance that out and to find ways to be able to cope with certain things that might come up and happen in our lives in a way to help not get in the way of moving forward with your care or your life, things like that. And that's all part of social work.
You got your MSW here at
Mhm. I did.
And then you went on for hired by UCD
UC Davis. I actually worked there as an X-ray tech. So yeah.
How did the state oriented? Or were you just hired by UCD?
Well, UC Davis is connected, like it is a state agency, but yeah, I worked for UC Davis Health. And so at UC, at the main campus on the inpatient side, and then also then eventually on the outpatient side. So yeah.
Some 50 years ago, I worked as a social work associate at Stockton State Hospital for the mentally ill, which I don't even know what it's called anymore. But we used to have a supportive group therapy. Even as an associate, I was able to participate in. But also we would have, we were on an acute geriatric, but it was a teaching ward. So we would have someone from UC Davis, a physician who would come in and explain some of the patients. We would have like rounds talking about individuals. One of the things I thought was interesting is that very often it wasn't the patient was the focus, but the real problem was in the whole structure that the patient came from. Like an unhealthy environment.
So that's like a systems perspective where you recognize that the individual has experiencing challenges and difficulties, and then when you take a step back and you look at the larger system around them, that they're impacted by a lot of different things, and then sometimes you can make adjustments to both things, helping the patient with each thing and do interventions with families or have family meetings for safety planning. Sometimes that is because we're all affected by our environments. There's also different theories in social work that people use for intervention. So one, for example, is ecosystems theory, where people are affected by their ecosystems, which is their systems in which they live and what they have access to. And so if they don't have access to those kinds of things, then their symptoms can get worse. So for example, if all of us were individually living in the desert and we didn't have access to this program, we didn't have access to healthcare, and we didn't have access to friends or family, then our symptoms, whatever that might be, would be exacerbated. And if you relocate somebody to a system that has some connection to those things, then they potentially will come back in balance. And so that is something that social workers look at as well. But there's all different types of theories, and there's all types of interventions, and everyone is unique. So it's called eclectic, where you would match whatever interventions to the individual, and you individualize it, kind of like that's the art of it, so to speak. And so if there's any of those kinds of topics or subjects that you would like me to teach more about or talk more about, I'm happy to do that.
I'd like to talk about 70 years ago. You go back to when I had my first job working for a large corporation in New York City. We were on the 40th floor in Rockefeller Center, and show only happened. And I guess I was a messenger at the time, and 19, 20 years old. There was so much bickering going on between different offices. If things got a little bit rough, they just fired the person. And they didn't even try to find out what was going on. And I noticed later on when I went back to school and I became a counselor, that they started having large corporations hire social workers to just settle discrepancies going on in the different departments. And it got to be a regular thing. They're still doing it.
So I don't know the extent of it in corporations, but I would say that that's a portion of like a component of mediation. And so mediators can frequently come from different disciplines. And so sometimes they're lawyers, sometimes they are social workers, even counselors do mediation and take classes and get certified in it. And then there's also another group of people called ombudsmen. Ombudsmen also do mediation and negotiation, and there are ombudsmen in some different organizations. And then there also are state ombudsmen, where people can call, make complaints, and they can try to help problem solve. The state ombudsman office usually oversees facilities and things that happen in facilities and helps with those types of things.
And are most ombudsmen social workers?
So I think that they can come from a variety of backgrounds. Because there's an additional ombudsman training that you do specific to that. So I don't know that they come from any specific thing, but social workers can get the additional training for that if they wanted to do that as a focus.
When I was growing, you didn't go to any talks to the
Yep.
We had a family, we ate together, we celebrated holidays
Yep.
together, 3 meals a day, kind of like the Blue Bloods on TV. So
Yep.
it was
Yeah.
always, since family. So I started working, I had no one to talk to, and I was constantly in trouble because people, you don't talk about that, you don't discuss.
Yep.
It's just an easy matter. One more thing I was going to say was that in my day, social workers were the people who took care of people who were down and out and needed a place to stay, needed money, like the welfare. It wasn't as diverse as it is now everywhere. Because people would not take advantage of that and do it by yourself, There was a lot of pride. You couldn't talk about pregnancy, you couldn't talk about
Right.
things.
Yep. You were supposed to pull yourself up by your bootstraps, even if you didn't have bootstraps. Yeah.
So they're still doing it because my niece now, New York City, she's going to Cornell. And she's taking industrial psychology. She has a job coming up at these places settle things. So it's still going on.
in the psychology. There is organizational psychology also that
And that's-
does help with business, how people arrange their businesses too. Mm-hmm.
Is there a need for any particular um, social work that is not being fulfilled? I know there's a shortage in nursing.
There's a shortage of social work. Yeah, there is. Yep.
So did you talk at all about how you want to fit into our stress reduction stuff? Do you want to
Um,
lead some activities there, or what do you?
Yeah, so what I did say was that if they wanted me to add some mindfulness exercises in there, I'm taking class for that. So I'd be happy to add that in depending on what everyone's interested. I know you already have part of a program started, and it looks like you have some very good stuff back there. There's also your book by John Kabat-Zinn back there, Catastrophic Living, which is connected to the mindfulness. He was the original finder of the mindfulness. You also have a book back there called, I think it's by David Burns. It's the new mood therapy, and that's cognitive behavioral therapy. That's a CBT type of a intervention to help people with anxiety and depression and improving those types of things. So I could also talk on those kinds of things, and we could do some activities on those types of things if you are interested in it.
Yeah, so you guys need to let
Think-
us know what
yep.
kind of schedules you'd like to schedule for, and be mindful that Linda Larson, who comes in once a month and needs a session, actually won't be here much this summer because she's having a hip replacement as we speak today. So I'm not expecting to see her in June, and
Mhm.
maybe not in July either. I don't really know. I'll have to one step at a time in that regard. So if this Linda can fill in for that Linda, I think that would be
I kn-
awesome.
Yeah, I noticed a lot of you attended that, and I thought that was really good. It is something that is important to continue practicing. So, and there are both short practices and longer practices too. So we can even think about different ways that you think it might be helpful for you to not just practice here, but take what you learn here and kind of integrate it in your life. So sometimes people find shorter things are able to be more transportable into their lives. And I'm happy to help with either of those types of things, just kind of thinking about what it is that you might find helpful. So several of you have asked, what are you going to do here? And a lot of it depends on what you all want. That's what social worker is. We meet you where you are, and we try to add in what you think might be helpful. And so that's what I'd like to do. And if you've never had it, it may not seem like it's an easy thing to think about, but I suspect that over time, as you think about things, some things will come up. I can also do different creativity exercises too, depending on what you're interested in, because I like to do painting and drawing and different things like that, projects. So
But the mediation process that
Yeah.
goes on in a lot of areas,
mhm,
in the forest,
yeah,
the attorneys do a lot of mediation.
they do. Mhm.
Well, family court services, we did that too.
Mhm.
Mediation, determined out custody,
Yeah,
and then we worked with attorneys, and that would get reported to social workers and
mhm.
psychiatrists and everybody. So it's a web.
Mhm.
It's a web, and it's also an art. Mediation is an art of navigating that web and bringing people together that maybe don't see eye to eye, and teaching them how to maybe be flexible at least a little bit to be able to meet in the middle. That's a pretty amazing thing. And a lot of that also involves a lot of problem solving, which can be a big part of social worker as well. Mhm. So does anyone have any questions? Any other questions you can think of? You've brought good ones.
Do you watch? Cable television
Do I watch cable
or
television?
HBO?
A little bit.
Because there's this show, I really thought that it's kind of reminds me of ER, because
Mhm,
it's cable,
mhm,
the kid. And one of the characters, when a patient found out something devastating about either a situation happened or their health, they go, we have social workers on hand, and you could talk to somebody. So I never knew that. You know, I mean, I knew the doctor would go over, but I never knew there was then I just had to stay overnight at the ER, just overnight for just TIA. I was kind of scared, but I didn't think I needed to talk to anyone, but it'd been nice to know that, just through. I don't know, do they?
Yep. Very frequently people don't know, but there are, and that's why I was trying to touch bases on some of these things, because they do have social workers in home health. They have social workers in the emergency room. They have social workers on the floors. So even tiny hospitals have social workers. And so that is what we do. When people have a hard time, when somebody ends up in the emergency room and comes in through an ambulance or things like that, sometimes if it's like an accident or some sort of a traumatic thing, social work is part of the team. I used to carry a pager that was part of the team, where once they knew an ambulance was coming in, you went to the emergency room and you met the staff and the patients when they came in. When people just go to the emergency room like on their own, or if it's not maybe a 911 call or something more urgent, or their family takes them, sometimes they're not identified as necessarily needing a social worker right away, but you can ask for a social worker. And that's what we do. We give people support with where they're at and what they're going through. And sometimes it can make a big difference to somebody, especially when like healthcare providers are busy doing the tests and the evaluations and the treatment planning. Social workers have the extra time and the space carved out to be able to help with people process what they're going through, because very frequently people are in shock when they get to the emergency room emotionally, like why, it's a big thing.
Going back to the not knowing part, it's just so universal. And my own personal experience, I think, is probably super typical, where my mom was having some issues and I knew I wanted to talk to a social worker. So I called her doctor and they said, well, okay, I guess you'll have to come and have an appointment so we can give you a referral to the social worker. So fine, I went through 4 months of manipulation to get her to go in and see somebody so she could get referred to social worker. And by the time we got to the social worker said, oh, well, she could have just made an appointment herself. She didn't have to go through her doctor. But the doctor didn't even know that.
Yeah. And so that's why I say to keep asking, like if you feel like you're not heard, ask again. It really is okay. Because sometimes people don't know how, to get a hold of people, or that it could be that easy. But most social workers, that's what we do. I mean, it's much easier to just talk to the people and answer the questions. And that goes back to meeting people where they are. We'd rather do that a lot of times than have it take a long time to get to us. And then by then, so, we're taught oftentimes the presenting thing is just really the tip of the iceberg. And once people are able to talk more, then they can tell you what's really going on. But that's something that takes time. And most of the appointments that people have don't have that kind of time built in. So it is a good thing to have a social worker who you can speak to and process with whatever you're going through, especially when it is the unknown situation.
Sometimes the problem comes in the referral process, because without referral, you don't get.
Yeah, depending on the situation. So that's an interesting point for you to bring up, because mental health is self-referral. So within the hospital, usually the social workers are just part of the team. So they're not individually billing in any way. So they're part of the team. In some of the healthcare situations are the same thing. If you see people for therapy, like a licensed clinical social worker, which I also do have my license, then therapy is a self-referral process. And so is psychiatry. So people can self-refer to those type of providers for mental health or behavioral health services without a referral from your doctor. And most people don't realize that either, because they're so trained to everything has to be this referral. You have to have a doctor's referral for your primary care doctor. And actually you can self-refer to a therapist in the community if you want to. And if they have an opening, you end up calling them and you can schedule an appointment. The tricky part is sometimes finding somebody who has an opening that takes your insurance.
But as long as they take your insurance, you shouldn't be worried about them not being covered.
Correct.
Regardless of the-
Which is something I can do a talk on how to find a therapist. If somebody's interested in that, I've done that hundreds of, probably thousands of times. Not that you would need it, but if you ever did, I could do it so that you would, or if you have a family member, under finding therapist that's covered under your insurance type. And, or I can talk about depression and how we measure it and what that might look like. Anxiety, I can do different talks on that, and I could do some stress reduction and some mindfulness, depending on what all you think might be helpful. So as it comes up and as you think about it, if you tell Carrie or Linda, we could start making a list, and I'll start working on ways to get that integrated into your program.
Well, my personal opinion, we need to do for you like we do with Linda, give you a
Mhm.
once a month slot, but this
Mhm.
is your time.
Mhm.
And people can come in and
Mhm.
ahead of time tell you,
Mhm.
hey, can you do
Mhm.
whatever it is they think you might want to do?
Yeah.
And then we still have a basis of stuff to kind of try out.
Yep.
First time might be rough, but then after that, you'll get some momentum going and ideas will pop up.
And I'll keep a list of whatever you guys think that might be helpful.
So look for her on the schedule and come up with ideas is the bottom line. Anybody in Zoom have any comments or questions you want to make?
Well, just that there's a lot to think about.
There is.
Nothing's focused yet, but
Mhm.
And I don't know who JD nor this little cute, adorable puppy is, but thanks for joining us. You see that?
Oh yeah, it's cute.
No, you can't see it. It's on the Zoom meeting.
It's really cute though.
Okay, I'm gonna end the Zoom meeting. Thank you guys for being here. And I don't think Linda's running away, so if you want to stop and ask questions.